Dr. Patel was really good at communicating what he wanted, and then he was also great at listening to other ideas, not just from me, but from everybody else, or looking at different offices. So taking pieces and parts from him, me, and other offices, it was a really good partnership to come together and make it what it is now. His older office was really small, and they needed a little bit more extra workspace. So to get a bigger lab, to get a better workflow in the sterilization. So then we went through several revisions, and it was his great suggestions, my suggestions, and all coming together to make what we have here.
I always wanted to have more spacious operatories and a nice sterilization room, dedicated lab, dedicated hygiene room, and dedicated surgical suites to perform over all-on-4 and sedation procedures in the office. The one that people feel like this is the place I wanted to go, that gives us a calm and peaceful mind. At the same time, my patients would know that we are up to date in the technology. That kind of feeling I wanted to provide to my patients when they entered into my office.
Technology has had a huge impact on Dr. Patel's practice growth. He will tell you himself the numbers and how they've just grown astronomically since implementing CAD/CAM, milling, printing. Really made a huge impact on his production and growing his practice.
My favorite technology would be same-day crown CIRUC. Why? Because it gives more benefit, like we can design everything in chairside. My patient don't have to come back for the delivering of the service or the treatment.
Their production has increased with the addition of CAD/CAM in the practice simply because they don't have to utilize a lab. They don't have to send out for anything. And ultimately, he has much more clinical control over the outcome of the services that he's providing for his patients. So it also increases the patient's satisfaction.
Since we started using a cone beam also provides the data that's sometimes not visible in a simple X-rays. Like in a 3D view, you can see if there is any resorptions there, internal resorption that you can diagnose. So we have seen quite a few cases where that kind of diagnostic would be impossible to do it using simple X-rays. With Patterson, I would say quality of service we have always received. I've been using Patterson's for my supplies and technology, the equipments, since 2018. Patterson, specifically speaking, Kelly Brooks and Brad Witter provided the service from when I was building this office. They gave me the plan to work around. We tweak few things. They suggested the equipment. They always had my back in case whenever I needed suggestions, options.
Our number one goal is to take care of the dentist, the practice, the way that they want to be taken care of. And I really pride myself in the fact that we've got a very open relationship. So great relationships. We hear back if something isn't working quite right. Patterson is there as fast as possible to get things working right again.
Anytime he has a question about technology, I feel like I'm his default person to talk and bounce things off of. He has a really clear idea of what he wants. He's very technologically savvy and driven. It's just walking through the logistics of how to make things happen or with certain workflows.
Let me give you an example. 2 days ago, I made a call that, hey, my Prime scan is not turning on. They were on the phone within 15 minutes to figure it out what is wrong with it. Once we figured it out on the phone, I told them hey, I think my nitrogen tank is leaking from print. Next day the service tech was here to figure it out what is wrong with it. I really appreciate that kind of help. If you have a technology, you will be able to attract more patients. You will be able to provide more service that you might not be providing right now. Investing is the key. We have to invest in the technology. We have to invest in a continuing education to educate ourselves so we can provide a better care and service.